How you doing?
Doing well.
All right, good to see you again. I'm glad you're back in here good, doing good while everything has been going on. So we just came to ask you some questions today. So first we wanted to know, are there any extra procedures that y'all go through to take care of us during the, because of the whole pandemic going on?
Absolutely. We have a quarantine room now
Okay.
that we can put students in if we have concerns about their health, if we are concerned that they're possibly contagious. We would put them in there. We do some extra things when examining students, like wear a face shield, and of course everyone's wearing masks.
Okay. You heard that. Everybody having a mask on, and we got a quarantine room now. I didn't know about that one. All right. Do you have to run like any symptom we come through with? Like, is it possibly COVID? Like, if any kid comes in here with like an upset stomach or a cough, headache, is COVID like the first thing that you want to chart it as?
No, not necessarily. I mean, certainly it's allergy season, so when someone comes in right now, if they have a frontal headache and a runny nose and a sore throat and maybe some nausea, the first thing I think is possibly sinus, but we also do further investigating. Have you been around anyone who has COVID? Have you known anyone, family members in the home or anything like that? So we investigate for it, but we don't assume automatically that that's what it is.
See, I'm glad that y'all do that because it's kind of hard to just have a normal cold now without your family being scared.
Yes, you're correct.
So being a nurse, you'd say is pretty much a hands-on job, right?
Oh, absolutely. I mean, when kids come in, I check their eardrums, their throats, anything that we need to listen to their stomach sounds, those kinds of things.
But with the pandemic going on, is there any has it changed how you can use all the equipment on us to examine us and keep a close eye on us?
Well, we certainly have to clean more frequently, sanitize everything in between every single patient. We already sanitized beds and everything.
Right.
So it's just an extra step, extra cleaning, just to make sure, and trying to keep people separated when they're in here, that kind of thing.
See, you guys run everything good. Definitely better than most people's family. Because you have a normal cold, it's, oh yeah, you're going to quarantine in your room. Is there any symptom a kid can come with that he's not allowed to come in here? Like maybe he has a symptom and we don't want that getting contaminated to the room?
No, because we would bring them straight in. If say they lost taste and smell, that's our hallmark sign of COVID. We would bring them in, we would take them straight to the quarantine room, and then we would put on our extra equipment and we would assess them in that room and sanitize everything out here.
Y'all running good. What do you guys do to protect yourselves?
Well, we wear extra what they call PPE, personal protective equipment, the face shields, the masks. We even have the gowns and shoe covers and gloves, everything, if we feel we need it.
So would you say that the pandemic has definitely made a change on your job?
Oh, absolutely. For us now, it's a lot more paperwork, a lot more phone calls. We have people calling in for quarantine, for positive cases, for testing. We've got to email all the teachers when that information comes out. We have to contact parents if the student calls so we can verify that information. There's just lots of little steps to it. And then make sure that the student stays out as long as they're supposed to and then returns when they're supposed to. As well as taking care of all the kids that come in who don't feel well.
Well, I'm really glad we got to have this time today. Thank you for participating in this.
Thank you. I'm glad to be a part of it.
Yes, ma'am. You have a good day.
You too.